Hi everyone, welcome back to another one of our chats with the lovely Dr. Heidi. And today we're going to talk all about gut health and dogs' poos because I am actually a weirdo and I am always looking at Jax's poos. I'm like fossicking through the what's going on. Is he dehydrated? What's he eating? What's he eating that of Rivers that's he's not meant to? And also, I also can tell if Rivers been feeding him his food because I'm like his poo shouldn't look like that. We want to talk about gut health today because it all comes out the other end, really. Just a general chat. And I've got a few questions from some customers. I guess my first one would be like healthy poo in a dog. Like, what should that look like?
So a sausage is a good
Yes.
thing to aim for. So in veterinary medicine, we classify a poo in a grade 1 to 5, 1 being a splat and 5 being a log, and then somewhere in between. And then we look at things like colour. So is it brown? Is it yellow? Is it white and chalky?
Yeah.
And those colours and form, structure, tell us a lot about what's going on the inside of the dog, and is there any evidence of gut trouble?
Yeah.
Dogs with poor digestion.
So when your poo's coming out and it's looking like it's all like, what are you looking like? I know what I'm looking for, like, but what are you looking for? And like, what should we be looking for as owners? Being like, oh, that's not good, or I need to add some more things to the bowl, or like, what sort of troubling things should I be watching for?
So there's some really basic signs of poor gut health in dogs.
Yeah.
So something an owner can look for is mucus along the stool. So the dog passing a fecal stool and then there being a jelly layer on there. Yeah. Constipation in dogs, so the dog's straining to go to the toilet but can't pass the motion. Intermittently soft stools, so passing a log and then passing a grade 1 splat and then passing another log might suggest that there's some poor gut health. And then you've got the ripping farters. So you've got dogs with gas or flatulence.
Yeah.
And those dogs are well known to us. Often in families, people try and pretend that it was the dog, but occasionally it was the dog.
It is very much,
A loud tummy, or what we call borborygmus, so the tummy grumbling, tends to suggest that we've got rapid transit through that gastrointestinal system.
Yeah.
The dog being an intermittent appetite, so hungry one day and then a bit fussy and off their food the next day. That can indicate poor gut health. Dogs trying to eat grass. So if your dog is out chomping on some grass, the biological reason for that is that grass has got little cutty blades on the outside of it, and the dogs know to go and eat the grass. It acts like a magnet, and it'll often attract hair in their stomach, and actually then the dogs can vomit and purge the grass. So they might purge parasites if they've got roundworm. But often it's if the stomach's inflamed, they've got gastritis or low-grade pancreatitis, the dogs will go and chew on grass. So that's a really important history point to pass on to your veterinarian when you're thinking about gut health in your dog. And then there's some unmentionables like eating poo, which we call coprophagia. So the dog didn't get enough out of the protein meal the first time round. So they'll actually smell a poo and think, oh gosh, that smells amazing. They're going to have another go at eating it. So interestingly, coprophagia is normal in some animals, like rabbits. Their gastrointestinal tract, it's normal for them to have a second go round, but it's not normal in dogs. So if you pass that, if you see your puppy doing that or your dog doing that, that's a really important thing to, don't be embarrassed about it. Pass that little pearl nugget on to your veterinarian and they will help you to sort out the behaviour behind that, what's going on.
So asking for a friend here, the poo eating, so like Jax doesn't eat his own poo or Doberman, or any other dog's poo, but I always thought that poo might taste like caviar or something, or be a bit of a delicacy, because he will hunt out a cat poo like there is no tomorrow. Like it's like chocolate to him, but
It's
he
a
wouldn't dare touch his
particularly
poo.
disgusting behaviour, isn't it?
Disgusting. A
So
dog's poo or his poo, absolutely not. But he's got the hot spots. He knows where they go every night, and he is fossicking. So, is there a difference between dog or cat poo, or do I need to take him to the vet tomorrow?
So the first thing I would suggest is that potentially the cat's food,
Yeah.
the protein meat content is higher,
Oh, okay. Yeah.
and that he's detecting that because obviously his nose is thousands of times more sensitive than a
Yeah.
human nose. And yes, unfortunately, that is not a nice behaviour, and it's not that abnormal,
Not that
particularly in
abnormal.
that breed.
Okay. Yeah.
So if you told me that, I'd say yes, unfortunately, that's exactly what they do.
Yeah. We've got
Mm.
this place. I call it Cat Poo Alley. And he
Mm.
is on the lead, and we walk through like he's straining. He's like, oh, get me off this. I've got so much to do. And I'm like, there's no way. Like I can tell every cat in the neighborhood comes here, and we're walking straight ahead. Like get on your lead and keep
Mm.
walking. Um,
Mm.
Also really interesting to talk about. Obviously, you know how poos come out brown and they dry in the sun to chalky white. Like that's not
Mm.
alarming, is it? And you're more looking for a white chalk coming out.
So I think you're talking about when a moist poo comes out, it's nice and brown, and when it
Yeah,
dries out, then the
yeah,
outside of the stool crumbles. Yes, you're
yeah, yeah,
correct.
yeah,
Quite normal.
yeah.
So, but
Normal.
if a poop comes out and it's white
Yeah,
and
you
it's
know.
chalky and falling apart, so there's a number of reasons. The most common reason is that the dog has been eating bone,
Yeah,
bone in, bone out.
yeah,
But there are other medical reasons. So, very important if your dog's not digesting food correctly and you're concerned about their overall gut health, then that's a pearl to pass on to your veterinarian. That is one
yeah,
of the signs of poor gut health in certain dogs. There's lots of others. So, things like there's a lot of skin and coat signs as well
yeah.
for dogs that don't have good gut health. So again, we're always talking about the microbiome
Yes,
and the dog's immune system being associated with the gut, but skin disease, skin problems often have a gut component. So things to look for is itchy skin is
yeah,
often a gut problem. Recurring ear infections is often.
yes, yeah,
Tinnitus is a gut problem. Poor licking, recurrent anal gland problems. So, anal glands, we've talked about before,
mm-hmm.
are little secretory glands at 4 o'clock and 8 o'clock around the dog's derriere, and they're
Mm.
often the size of a pea with a tiny little outlet. And if there's inflammation around the dog's bottom, then these get blocked up and they become quite uncomfortable for the dogs. The dogs might scoot. You can have a yucky metallic smell around the house and the carpet, which is particularly objectionable. Many
Yeah,
people bring their dogs to the vet, but the underlying reason is that we need to address their gut health. So when we get their gut health rock star, then often anal gland issues will go away. Recurrent hot spots is something that often people don't realise is a gut issue. A very dull coat, so your
yeah,
dog doesn't have that beautiful rainbow, sparkly shine that we get when we've got enough essential fatty acids. The body's not
yeah,
absorbing those properly. Zinc deficiency, copper excess, those things can look like that.
yeah,
If your dog is particularly shedding fluff everywhere,
yeah, yeah,
that can be a sign of inflammation and poor gut health. Flaky, itchy skin, and then, of course, our lovely chronic allergies.
yes, yeah,
It's the reason that we holistic vets love to talk about food being medicine, because in veterinary medicine, it's very important that we don't just look at what's presenting in front of us. We are scientists, we do understand the whole body, and many of these diagnosed problems of otitis, ear infection, dermatitis, skin infection, and then recurrent allergies, if we peel the onion, which holistic veterinarians are
yeah,
trained to do, we go right back to often finding the root cause. Not just antibiotics is not going to cure those problems, steroids is not going to cure those problems. We're actually hunting for the why. what
Yeah.
set the dog up in their little biochemical body to create inflammation, and what is it trying to tell us? And that's the whole reason, again, for advocating strongly for our patients to try and get rid of these issues, not just make them go to the vet for the whole of their lives and have these recurrent infections. So it can be challenging as a holistic veterinarian, but it's also incredibly rewarding that we don't have lots of patients that have recurrent ear infections, nibbling their feet, recurrent anal gland infections, and poor gut health. Those things are actually able to be addressed and fixed, and that's often people don't realise that that's the case. But you'll speak to a lot of vets worldwide, holistic vets, and that is absolutely their clinical outcomes for their patients.
It's just crazy how aligned, like, obviously the human and dog body, like when I think about it, like myself and my gut health, and then and how it just all translates, you know, like what you're talking about, it's like the gut's like this central pivot, and it is for your dog. And if you align and get that right, all those other issues you seem to be experiencing usually just go away. Like, it's like, just start at the gut, reassess the gut. And the amount of conversations, and you must get it 5 times a day. I only get it 3 times a year in an expo. That, oh no, it's just he's got itchy paws. I'm like, no, it's something else. Like, it's starting from somewhere else. It's ending at the paw.
That's right.
There's a root somewhere else, and it's so important. And like, just even talking about anal glands, like I remember we had a dog years ago before we were on this journey. And we just thought it was normal that you just went to the vets and you got them drained because they just didn't have draining anal glands. And it's like, no, get the gut health right, get the poo size right. They should drain automatically on their own. So it's just all of those things that you shouldn't need the vet, you know, like hopefully you don't need the vet, like get the body functioning, like, and get it. Yeah, it's super.
And that's a great point. That there's common things that owners accidentally do.
Yeah.
Upset their dog's gut health, and they don't even realise they're, you know, potentially not informed. They certainly don't do them intentionally. But there's lots of things that I, as a holistic veterinarian, see. And when I look back in the history of the dogs that I see as a second opinion, and I see 2 or 3 second opinions a day, then I can read through the history and go, okay, that started there. I see that. I see those. I see those. So I'd love to talk to you about some of the things that owners accidentally do that actually upsets their dog's gut health.
Oh, let's do it, because I'm so keen to know. I want to, and people might be like, hey, that's me. I'm feeling seen. Let's do it. Yeah. What have you got?
So number 1 is frequent antibiotic use.
Yeah.
So antibiotics save lives, absolutely, when they're needed. And they can kill harmful bacteria. But guess what else they take out? They take out the beneficial bacteria as well, and it can take months for those beneficial bacteria that actually have a job to do in the microbiome, producing B vitamins. That helps with the whole serotonin dopamine reflex, the gut-brain axis, and it impacts dogs' behaviour. Many of those dogs will end up anxious, and when we look back as to why, there's a clear history of having, they ate something, they had an upset tummy, potentially they were prescribed antibiotics, and unfortunately that then has triggered a cascade which has led this towards this dog's poor gut health. So the golden rule is never in a puppy under 1 do we want to give them antibiotics, unless of course they've got something terrible like meningitis and we have no other choice. We really want to protect those good guys in the gut, because that sets them up for success for life. There's wonderful research on this in human infants under 1, and as parents we should all be protecting our little one's gut microbiome, and as pet parents we should advocate, are there other options? And the answer, the good news is yes, there are. There are other options other than giving your dog antibiotics. Another reason, another thing that owners do to upset their dog's gut health is they'll often exclusively feed ultra-processed food. Often one brand, one type, for life. And unfortunately, we know that diversity is king. The gut microbiome is this beautiful bell curve, and we want all the players on the field. The more types of beneficial gut bugs in the dog's gut and microbiome, diversity leads to a highly resilient immune system, which is 90% of their immune system to fight infection. So when you monofeed, you selectively kill off all the other good guys over here and all the other good guys over there. So I'm very interested in the microbiome. I've had a lifetime of understanding infection, immunity, gut health, and how it impacts the dog's behaviour and overall health. And certainly we want diversity. We want minimum 20% veggies in the bowl, the same polyphenols, antioxidants, vitamins and minerals and fibre that you and I get from fruit and vegetables is entirely appropriate to give to our dogs rather than 100% highly processed food. So we want natural enzymes. We want, phytonutrients for the gut, and dry, highly processed foods often contain less dietary diversity than including some fresh, unprocessed food. So don't feed the exact same food for years. Dogs benefit from variety. So different seasonal sources, different seasonal proteins, seasonal vegetables. Seasonal fruits and whole food additions. So the more diverse the diet, the more diverse the microbiome. And look, as a holistic vet, I had conversations with my colleagues, and I love to advocate for natural health, both in human medicine and obviously as an athlete, but also in my job as a veterinarian. And we don't all agree. But research is starting to back us stronger and stronger. And certainly I'm passionate about the fact that we're right.
Totally. And it is. It's so true. Seasonal, mix it up. Like, Jax is hanging out by the bench when he sees me chopping up Rivy's veggies, because he's like, I'm going to get off cuts. I can feel it. Like, give me the veggies. So it's just mixing it up, making it exciting. I guess if you relate it back to a human again, if you're eating the same mono food every day, you start going a little bit grey. You'd just be a little pale human, There'd be no flavour to you.
And also I think we've got to, as scientists, and we are all studying the evidence, it's very important that we look at where our evidence comes from. Is there a conflict of interest? Has the research been done by the company that might benefit from selling one brand of food? Then I would suggest you could maybe put that in context and think, well, okay, let's read all of the thoughts around that, not just potentially the richest voice or the loudest voice or the most corporate voice. I love scientific debate. It's one of the things I love most, because what I've realised is what I studied nearly 30 years ago. We thought we were right, and of course we've now worked out that actually we didn't know about A, B and C, and we have more diagnostic tools available now, and we are definitely understanding that there's a price to pay for giving our dogs antibiotics and giving our dogs steroids. So steroids is another thing to be very judicious about the use of. Entirely appropriate to use those where clinically indicated, but you must understand that they suppress the immune system, that they can make dogs up to 30% more likely to become diabetic, and you should be informed. Informed consent is really important, because a lot of the people that I see that bring their dog along for recurrent dermatitis, itchy paws, skin infections and rounds of antibiotics and rounds of steroids were never told that this is suppressing their dog's immune system and potentially making the dog more susceptible to cancer. So that's a big risk, and please advocate strongly.
Nice. Do you have another one?
Thing that I don't realise that can upset gut health is too many treats.
Treats.
Too many treats. So if you're guilty of giving your dog too many treats, not looking at anybody too close,
Yeah.
is make sure that you read the label. Is there
Yeah.
artificial flavours? Is there colours in the treat to make it look red and meaty? Particularly, please avoid red 40. And you can pop into
Yeah.
ChatGPT, what is red 40? Well, it's a carcinogenic red dye that has been approved in pet food and some children's food, horrendously, like M&Ms. And in my opinion, as a holistic vet, has no place, particularly if your dog has poor gut health. We want to whip those things out of there. Excess sugars and excess starches, sometimes to make poor quality treats more palatable. Sudden diet change we all know that one, upset our dog's delicately balanced digestive system. So blend quietly.
Yes.
90-10, 80-20, 70-30, eventually 50-50. Give the gut microbiome time to grow, diversify, and have the correct bugs to digest the correct new food and protein.
Yeah.
Stress impacts our dog's gut health like it impacts our own gut health. Cortisol is very powerful, and it can certainly, we see some stressed dogs that when I suggest to the owner, is the dog suffering from physiological stress? And the answer is yes, actually they are.
Yeah.
So putting your dog in the kennel can be really stressful for the dog. A household conflict, is there another dog that is trying to bite your dog or stop your dog from getting to their food?
Yeah.
That can be very stressful. Major routine changes in the household, including having a new baby, can impact your dog. Chronic pain. So if your dog has discospondylosis or bony bridging the spine or osteoarthritis, sore pain, sore back, sore hips, sore knees, it's very distressing, and those dogs' cortisol levels will be higher, and you can absolutely see diarrhea and an upset tummy.
Yeah.
Purely from pain and a lack of exercise.
Yes.
If you don't exercise, it's been shown that that is negative for the behaviour that your dog needs to exhibit to correctly manage ablutions.
Yeah. Exactly. It's so good. And I feel like Jack's always, the walking just brings on the poos, you know? It just gets it out. They
That's
get them
right.
moving.
Yep.
It all gets everything rumbling.
That's how that's supposed to happen.
Yeah. It's
We've
good.
talked about not using steroids or not overusing steroids. Please also don't excessively deworm your dog.
Yeah.
Now, this could be controversial,
It is.
but as a holistic vet, I would advocate that we should test our dogs for parasites. Absolutely. If they have parasites, let's treat them. But if your dog has zero, then isn't that good to know?
Exactly.
So you're not giving them artificial pharmaceuticals that the dog may not process all that well, or that in itself may actually upset their delicate ecosystem. And then probably one of the last things I would advocate for good gut health and firm poo is fibre.
Yes.
So one of my favourites is pumpkin. So you can process a lovely homegrown pumpkin or organic pumpkin, cook it up. Remember those lovely ice cube trays that we do ice cubes in? Put them in the freezer. Put mashed pumpkin in those and just set them and freeze them. Great if your dog has anal gland issues, beta carotenoids and wonderful fibre, and you're just going to pop a pumpkin block on the top of their meat patty and their lovely veggies and mix that in. So then you've got a nice supply. You can backload pumpkin once a month for your dog if you have anal gland issues.
Yeah.
Instead of buying something synthetic that might have wheat husk. Wheat, of course, is often genetically modified, and it can be highly irritant to the gut. So pumpkin, not so much.
Yeah.
Trying to think out of all the dogs I've allergy tested if I've ever had a dog allergic to pumpkin. And I believe the answer is no. It's certainly not common. So
super low allergen.
Pretty safe.
Yeah. Oh, without that, I'm actually going to make a list, and so if anyone that's listening, I'm going to make a list. I'm going to do a post on this as well, because I think it's super important everything you've just said with what common things that we could be accidentally doing or things we could be aware of that we can fix kind of quickly. And I guess what is awesome as well, as I'm going to do a little plug for Doggy Daily here, is that because everything we've spoken about is like Doggy Daily is the absolute immunity boost for your dog's gut health. So if you are getting any of these symptoms that we've spoken about today, if you've got a funny tummy, if you've got firm poos, soft poos, like Doggy Daily really is the optimum blend to re-sort the gut. But you also, as Dr. Heidi talked about in point number 4, sudden change of diet, you do have to blend Doggy Daily in slowly. Don't lamb blast overnight. Build from a quarter of a teaspoon up to the correct serving size so that you don't upset your tummy more, because it's a change and there's new ingredients. So it should be treated with, I don't want to say caution, but it should be treated like, well, like.
Well, there's a plan.
Yeah, a plan in place.
And the plan is to blend,
Plan is
because
the
if your
blend,
dog
yeah.
hasn't had turmeric before,
Very much, yeah.
then we want to introduce it in a way that is, according to the plan. We know that works, so that's good. Actually, the other thing that's really important to point out is that make sure that you're not feeding your dog a diet that's really high in inflammatory ingredients. So again, I challenge people, please learn to read an ingredient label.
Yes.
And if in the ingredient label there's words in there that you can't say or spell, like 1,2,4 diethyl tetra something, then perhaps that's not a good idea to be putting it in your dog if your dog is displaying poor gut health, behavioural signs of anxiety, chronic itchiness, recurrent gastrointestinal issues, poor body condition, chronic inflammation, bad breath. Those are all signs that your dog could be more reactive. And feeding a highly inflammatory diet is not a good idea. So dogs do poorly on diets containing things like excess refined carbohydrate, artificial ingredients and additives, and very poor quality fat. And if you're not sure, then actually having a conversation about nutrition and about ingredients, you don't have to understand it, but please seek advice from someone who is going to advocate for the long-term proactive health of your dog as their primary goal.
Yeah.
And someone that's preferably passionate about nutrition and health.
Yeah, absolutely.
Gut health particularly.
Unbiased, able to give advice that's you're not paid by the food company,
and wanting the very best for the pet.
Totally.
Not just taking advice from Aunt Ruth on some community page, who may mean incredibly well.
Exactly.
But we want to be very careful about the advice that we're taking. So as a holistic vet, my final points would be go for a species appropriate whole food. Yeah. Diversify your protein source. So think of exciting meat proteins like rabbit patties, possum patties, goat patties, venison patties, salmon patties, lamb and salmon patties. Those are all terribly exciting. Yeah. Omega-3, omega-6 fatty acids are really important. So, and ensuring the non-rancidity of those, particularly if you're dealing with fish or fish oil. Yeah. Fermented foods, where appropriate, can be really helpful for gut health. Prebiotic fibres. Regular exercise, super important. Sunshine, super important. Vitamin D, super important. Good sleep, low stress. Sounds familiar, doesn't it, for good health? Sounds like everything I should be doing. Judicious use of antibiotics. Yeah. If at all, absolutely. And maintaining a healthy body weight for your pet. So, Dr. Heidi tips, stand above your dog, and if they look like a peanut with a little dipped waistline, great. So their shoulders are wider, they've got a little waist, and then their rump is wider, then that's good. If they look like a teardrop, where they're skinny at the front and they've got a wide-ended loader bottom, then potentially that's not ideal. Or if they look like they're a rectangle, so their shoulders and their tummy and their bottom are straight.
Yeah.
That is obesity. They potentially have visceral fat in and around their tummy, which increases the risks of not only cardiovascular disease, but lots of problems in the tummy. It's a poor sign of poor metabolic health to have no waistline. And then, of course, the very obvious roly-poly, massively obese pet, where you can take a chunk of dog on the right and a chunk of dog on the left and give it a shake and everything wibbles. And again, we have to not do that to our pets, because our pets don't choose what they put in their bowl. We are entirely responsible for ensuring our pets have an appropriate body weight. And if you need help, don't be embarrassed.
No,
reach out, and we can certainly give people some tips and advice.
I know, we are entirely control. We put in what they put in their bowl. We also do, like, the amount of exercise they do is led by us too, you know, like it's how we take them out and how we do things with them. And they can't do that without our help, and they also will eat whatever we give them. So it's making sure that they're eating the right things and not too much. But yeah. And also I know that feeling when you go to the vet and you've got to get on those scales with your dog, and it's just the scale of, I don't want to call it the scale of shame, but I feel very like
the scale of truth.
The scale of truth is the right word. Yeah, you put them on, you're like, oh, what were they last time? What are they like? You know, it's yeah, it's good. It's a good reality check, so it's good.
One last thing. So as well as having normal stools, for pets, you want to have a glossy coat.
Yes.
A good muscle tone, stable energy, and a strong immune system. Bright eyes, and that can be the foundation of overall health. So if you've got those things, marvellous. Well done, gold star. Pucky pucky. Well done. So that's what we all should be aiming for as pet parents. And my golden rule is always food first. Good food is good medicine.
Medicine, exactly.
So start with that first. First of all, we do no harm in veterinary medicine. And it's very important that we all remember that that's what we all said we were going to do. So I have dedicated my life to that very point.
Thank you so much. And this has been awesome.
Pleasure.
I feel like I'm very up to date now on even more up to date on healthy poo and gut health. So it's great. Cool. We'll see you again next week.
Take care. Bye, Sam. See you.